Welcome to Proud Veteran Outreach. My name is Jim Jurowitz. I'm a Vietnam Area Army veteran. We are brought to you by the Vet Centers of Minnesota, located in Brooklyn Park, St. Paul, and Duluth. And our purpose is to reach out to find military veterans who are struggling or isolated or who are having difficulty adjusting to reentry into civilian life. Today we have a guest, Ryan Haugen. Thank you, Ryan. Ryan Haugen from the Silent Warrior Project. I'm excited to have Ryan with us because he brought Abbott with him, and we are honored to be present with Ryan today. And we want to talk to Ryan about the Silent Warrior Project. So rather than me talk about it, I'm going to ask you, Ryan, to introduce yourself and first of all, shake my hand. Thank you for being a military vet.
Thank you for your service.
You are a veteran with PTSD, so there is a honor for us to hear firsthand the struggles. But please introduce us to Silent Warrior Project.
Sure. As Jim mentioned, my name is Ryan Haugen. I'm the founder of the Silent Warrior Project. We are a 501c3 nonprofit organization. Our mission is to reduce veteran suicide rates related to post-traumatic stress disorder and military sexual trauma. And we do that by taking veterans on retreats, which are free to them. And we practice mindfulness-based stress reduction, contemplative silent reflection, Reiki, Tai Chi, and have a massage provider on staff to help reduce some of the symptoms of post-traumatic stress disorder.
Okay, so we identified the fact that the Proud Veteran Outreach is looking to help identify the isolated or lost military vet. What we mean by that is that when a military vet adjusts back into civilian life, it's not comfortable for them and it's not easy for them. And if they're alone with no family, they may isolate and hide. So we're asking civilians who may know of a vet that may live in their apartment building or may know of a friend who lives next to a military vet or may even know a military vet that's living on the street. The suicide rate is high with military vets. It's anywhere from 20 to 23 suicides a day. And in the homeless community, 25% of all military vets are related to the military. And the statistics we have from other parts of it is that 48% of all military vets are living in pain. So it's that pain that could be driving them to suicide or homelessness. So let's talk about what you do to treat PSD or how somebody would approach you that has PSD and what services you offer.
Sure. I would start by prefacing my explanation in that we are not medical providers. We do not provide treatment, counseling, or therapy. What we do is we invite veterans, and I'm glad you brought up, isolated veterans and veterans that may not be in the VA system, may not be VA eligible, may be homeless, to help fill a gap that the VA currently has. And we invite any of those veterans on a retreat. It is free for them to attend. And we go to, our next retreat is in April at the Mount Olivet Conference and Retreat Center. And we'll spend some time in nature, decompressing, much like the World War II veterans did.
Excuse me for interrupting, but
Absolutely.
A vet can still attend that retreat, so they just simply go to your website and fill out the form. Is that the most expeditious way to do it?
Yes, that's a great question. We do have an application part of our website, and we get the registration process started. There's minimal screening and some conversations that will go on, and then we can invite the veteran on a retreat.
And who would do that screening? Do you have a staff? Do you do it? Who does that screening? How does that screening process work?
That's a great question. As far as staff goes, everybody in the Silent Warrior Project is a volunteer, so none of us are paid. We do have 2 licensed social workers as volunteers. We have a couple occupational therapy providers, a psychologist who's a board member. They're all licensed and certified, and they help us with the screening process. And they all are familiar with working with veterans with post-traumatic stress and military sexual trauma.
That's great. And so you are a 501c3, correct?
Yes.
So therefore, we can invite civilians also to volunteer to help you with your services. So this is an
Yes.
invitation out there to the public to go ahead and go to the website and get stimulated to help the military vets.
Yeah, and we would be eternally grateful for that. There is a donate button on the main page, and that goes right into the Silent Warrior bank account. And I can't say 100%, but a majority, of our contributions and donations go directly to the mission and to put on the retreats.
Okay, so we're going to cover a lot of information here, but I would like to know what happens on the retreat, how long is the retreat, and how many times a year does the retreat happen?
Good question. The retreats, we've done 5, and our 6th is, like I said, at Mount Olivet in April, and we try to do them quarterly. We have 4 planned for 2019, 6 to 8 planned for 2020, and 10 for 2021. That is our 3-year plan. We can serve up to 10 veterans at each retreat. So that gives you kind of a scope of how many veterans we're looking to work with. And we, historically, up until we became a 501c3, my wife and I were funding the retreats. And I think she's grateful that that's not the case anymore. But we pay for the retreats in advance, so we're funding for them as we go. We do not have, we don't even have $1,500 in the bank, let alone $1 billion in the bank. So, your contributions go directly to the mission.
So, Ryan, let me ask you again, what happens on the retreat?
Yes.
So you're treating PTSD, are you treating suicide? For 3 days, what is the course of, what's the agenda of what happens?
Yep. Our agenda runs from Friday at 4 p.m. to Sunday at 4 p.m. And there's a number of activities. Mindfulness-based stress reduction was developed by John Kabat-Zinn. His book, Full Catastrophe Living, goes through exactly what we do with that. There's yoga, there's body scan, we do Tai Chi, Reiki.
This all happens at the retreat?
Yes,
Okay.
and I think you're leaning to a point where we're getting to where these need to be a week long and not a weekend, and we're moving in that direction. The other things we do is we have time to have fellowship and sit around a bonfire and share our personal experience, strength, and hope with each other, which I found at over 20 years getting therapy at the VA is one of the most therapeutic things for me, is sharing my experience with another veteran one-on-one. And that's also the least scary, and it's the easiest for a veteran to get out of their shell, or to be able to openly and honestly share what they experienced and what brought them to where they're at now. So there's a bonfire time, mindfulness-based stress reduction, Tai Chi, which is fluid body movements, an old Chinese practice that these have all been proven therapies for post-traumatic stress disorder.
And these are overnight retreats, so you're providing meals and sleeping accommodations?
Yes.
Or is it?
Correct. Yep. So at Mount Olivet, we'll have 2 areas for bunking, men and women, up to 10 veterans, and then we'll have about 8 to 9 staff or volunteers that will be helping to facilitate the retreat. So up to 20 people per retreat. And each retreat costs about $5,000. And there's transportation costs in there, lodging, meals. The nice thing I like about Mount Olivet is all the meals are cooked from scratch, and it's great food.
Okay, again, I'm putting my little request flag out and saying if a retreat costs $5,000, if anyone wants to donate to that retreat, then we can have more retreats. And also, if there's a retreat center that has some vacancies and they want to donate their retreat centers or event centers for this purpose, then please go to the website, call in, and what we need is more retreats.
Yes.
So I'm putting in a pitch for you.
Thank you.
Okay, so we're going to talk about PTSD now.
Yep.
And so you're a victim of PTSD. How did it happen to you? What is normally what happens? And then, because we like Abbott, we want to know how Abbott helps you.
Sure. I appreciate all of those questions. I'll start by saying there is no normal and there is no usual. Everybody's post-traumatic stress and military sexual trauma stories are unique. And everybody has their own defined experience. I can only share my own experience. And I served in the Gulf War on submarines, and we went through a number of operations that I can share. A number of the other men that I served with are also experiencing post-traumatic stress as the result of the duty that we incurred. I also experienced military sexual trauma, and that is not something that gets talked about a lot. I advocate for veterans with MST and M1, and I don't mind putting it out there in the public because people are killing themselves as the result of suffering from this. And after my experiences in the military, I turned immediately to drinking and drugs to just get to oblivion and get to sleep. And that went on, and for a period of time, the Navy sent me to treatment. I got sober and stayed sober the remainder of my Navy career, and became an active member of a 12-step fellowship that helps with that.
And that is just with military peers?
No,
Or
it's an anonymous fellowship that works with substance abuse.
Okay.
And that participation led me to an individual that had extensive experience in contemplative or centering prayer, which we have developed into contemplative silent reflection. And the VA, I have nothing but great things to say about the VA and the VA healthcare system. I was prescribed mindfulness-based stress reduction over 12 weeks with Dr. John Rodman at the VA, and I'd recommend that for any veteran with PTSD.
Well, I'm going to challenge you on that because the
Sure.
VA certainly could take in more vets.
Yes.
They don't take in enough vets.
Yes.
There's a lot of vets out there that are struggling, and I'm going to put in a plug for the VA to get better.
And I would say we refer veterans to the VA. We do not pretend to replace the VA. We try to fill in some gaps and be a support mechanism for somebody to get more long-term therapy from professionals.
So we still got a lot of information to cover, so I'm going to push you a little bit.
Okay.
What is Abbott doing for you?
Abbott is a certified and licensed PTSD service dog. He was trained by the organization called Helping Paws. The vice president of our board, Harry Hurley, was one of the individuals that got Helping Paws up and going 40 years ago. And they are an organization in Minnesota, and I'll get to what he does. They're an organization in Hopkins, Minnesota, that trains dogs for veterans of PTSD. What he does for me, he senses my affect. He can sense if I get agitated, irritated, upset, angry, afraid, and he will provide some comfort and a barrier. I can share a couple experiences of how he is effective.
I'd like to hear that story.
About 15 years ago, I was at a county fair with my young son at the time, who was 4 or 5 years old, and a man came up and put his hands on my son, and I put him in the hospital with a crushed trachea. Now, that's not an appropriate way to respond, but that's a common thing that happens with veterans of PTSD. Recently, I was at Costco with Abbott, and somebody did a similar kind of thing. I had my young daughter in the cart with me, and Abbott put himself between me and the man that was walking up behind me and nudged into me, which made me look to my left, and I saw the gentleman walking up. I wasn't startled. I didn't respond inappropriately. That's one thing he does for me. Another thing, I don't mind sharing personal experiences because it's what helps us other veterans. I punched my wife in the middle of a nightmare about 2.5 years ago, right before our daughter was born, and my wife said, "This has to end. I'm done with this." The PTSD struggle that the family has. And shortly after that, I met with Harry Hurley from Helping Paws, and he got me Abbott. So how Abbott helps with that? His trainer, Lori Harkness, slept on the couch for about 6 months and flailed and flung herself around and trained Abbott to wake her in the middle of a nightmare. So if I start to have nightmares and get agitated or move around, Abbott will wake me up, thus preventing any assaults on my family or children or anything. And so those are a couple examples of how he helps every day and just provides a level of comfort. And I can, I don't do tricks with him, but I can exhibit one. Abbott, come here. Rest your head. So rest your head is something that he does to provide comfort. That's how he was trained, and he responds immediately without question. And he's very loyal. And that's one thing that us veterans need is someone that we can be loyal to.
How about Abbott, go get a beer?
No, he does not do that. I don't drink in the first place. In the second, he's not trained to retrieve drinks.
I was just kidding.
But actually, some service dogs are. Abbott, drop.
That's impressive.
boy.
How many years have you had Abbott?
I've had Abbott for 2.5 years. He'll be 5 on April 21st. So he was
Great.
trained for about 2 years, and then I got him.
Well, needless to say, I'm pretty inspired by your organization. Your organization is only 2 years old, and you've made all of this progress in 2 short years, so that's pretty impressive.
Well, I would say, as a quick correction, we started in 2015.
Okay.
My wife and I self-funded it for a couple of years, and then it, I said...
Well, then I'm going to correct myself
Yeah.
and say 3 years is pretty impressive.
Yeah. Well, there's a lot that happened in that time. And I was introduced to some really good people through Harry, and they've become our board of directors. So
Well, let's talk about your
Sure.
board of directors in a minute. First of all, I want to help the families out there,
Yeah.
or even the civilians, to look for the signals as to what are the signs of both PTSD and where there may be someone who's thinking about suicide. Can you give us some indicators to look for in those situations?
I think the best thing I could say is you could go to ptsd.va.gov and get the list of symptoms, and everybody is different. I can share my own experience. My family witnessed my life go downhill: a DWI, a divorce, a bankruptcy, excessive drinking, drug use. A lot of these things are ancillary
Gee, you could run for president. No, I'm only kidding.
to the struggle with post-traumatic stress and combat trauma and military sexual trauma. This is how it manifests itself, and you might see your military veteran that you love struggling with job loss or homelessness or alcoholism or drug abuse. There's a component of self-medication and isolation. I didn't want to seek help, so I tried to find help in booze and things that were self-destructive. And so that is kind of how it looks, or what it looks like.
So I have an idea, a question. So what does the military vet, what is their response when they don't want help? How does the civilian overcome that? Or what should they do if they approach a military vet and he says, no, I'm fine, leave me alone? Do you have some kind of resource that might intervene, or that they could call for intervention, or because the guy says, yeah, I'm fine, leave me alone. The next thing you know, he might be hanging in the closet somewhere. Mm-hmm. So is there some kind of help you can offer for that, or guidance?
Sure. I'll preface this by saying, again, I'm not a medical provider or an expert. But as a veteran with PTSD, one thing families can do is they can reach out to the Veteran Suicide Crisis Line, or the National Suicide Hotline, and get expert tips there. I'm not going to give out any tips because that's not my lane, my expertise. But another thing that was helpful for me is my family reached out to some of the men that I served with in the Navy, and they contacted me. And for whatever reason, it's always easier for me as a veteran to talk to another veteran and share my experience. It's more challenging to reach out to a professional or go to the VA and get help. So American Legions, VFWs, Disabled American Veterans, some powers of attorney, and these organizations are great resources for veterans to get involved in. Your local American Legion or VFW, to find other veterans that you can connect with, and then get referred to good resources. There's the SAFE program that you were mentioning that people can call to get help if they're struggling in crisis or suicide. You can go to your local emergency room and not get turned away. You can go to the VA emergency room and not get turned away. These are things that I've done in my own experience that I found helpful and useful. But I think
there's only one VA hospital here, right?
No, there's one in St. Cloud, and there's one in Minneapolis, and they are vastly expanding their resources for post-traumatic stress treatment.
Okay. The other thing that I would like to impress on our audience is the fact that you are working with a talented team of advisors and professionals who are helping you grow and be successful. So I would like to spend some time for you to identify who those people are and honor them and with their participation in your business. So
Sure.
Would you please tell us who they are?
I will. And I'd start by saying that we are incredibly grateful for the volunteers that we have that are willing to help us help other veterans with PTSD and MST. The vice president of our board is Harry Hurley. He's a Vietnam veteran, professional golfer, so happens to be, and helped get Helping Paws started. The secretary of our board is a man named Phil Sterland, who's the CEO of the Summit Group in Minneapolis, and he's a well-known business professional. Our medical advisory board member is Angie Foley, who works at Alina in the Sister Kenny Cancer Center. And John Lawyer is our spiritual advisor and board member. He's an 84-year-old veteran, lieutenant colonel, retired, worked in the Nixon administration with Kissinger under the Secretary of Defense, and has degrees from Harvard, and he's got certificates in spirituality, and is just a really wonderful resource to help guide us in what we're trying to do. We offer spiritual help, not religious help. And then we have a collection of advisors apart from our board. Lee Rainey is currently at Thrivent and is one of our business advisors. Carl Eller from the Minnesota Vikings, many people are familiar with, is a public relations advisor and director, and helps with some fundraising. And he is a champion of veterans with PTSD and has worked with Ars Bellum Foundation and is a veteran himself of the Minnesota National Guard. And then we have a host of other volunteers. Katie Strubb is a licensed social worker. She helps facilitate our retreats. Lina Knox here from the Brooklyn Park Vet Center is going to be helping with, she's a licensed social worker to help us facilitate. We have a couple occupational therapists, Michelle Darger, and a lot of these people were referred to me from Angie Foley, and that's kind of how these organizations get they evolve and get developed. It's kind of, people, and then you ask them to reach out to the other great people that they know to bring them into the organization to serve veterans.
Thank you for that. That's an impressive list, and if there's people out there that know any of those staff people or advisors, then certainly we'd like to encourage you to be in touch with them and lend as much support as you can. All right, let's talk a little bit about donations. How do you take donations? What kind of donations would you like? And what's the process or the method of doing it? I'm assuming you're not staffed enough to send out any direct mail pieces to people or have a list of anything to solicit with. So how are you raising money?
Yeah, you're right about that, and that's a great question that I appreciate. Anybody can go to our website. I think it's posted here, but it's www.silentwarriorproject.org. There's a donate button there, and you can read about our organization, who we are, what we do, and where we're headed. You can mail a donation or a contribution to Post Office Box 1104, Burnsville, Minnesota 55337. That is only for the Silent Warrior Project. I go out and fundraise and solicit funds myself with Harry. Also, we speak at American Legions. We're having a golf tournament, which is a fundraiser, and a dinner or a gala on September 19th at the Pioneer Creek Golf Club in the American Legion of Mound. And a lot of it is me emailing out to people that I know in the business community and inviting them to help us help veterans with PTSD through their contributions. I'll share Thomson Reuters has donated $1,000 through their employee, John Tracy, who's one of our volunteers. A lot of employers can do that. Bell Banks has put us in line for about $2,500 over the course of the year, where their employees can can donate through their Pay It Forward program at Bell Bank. Phil Sterling is doing some work with Lee at Thrivent to get us involved with Thrivent Financial. And yes, we are, of course, willing to take any contributions. And you should know, as a 501c3, you can designate your contribution to go for what you want it to go for, and then the organization is legally required to do exactly that. So if you put on a memo line for retreat only, that's the only way we can use that contribution. And I do that myself when I contribute to other organizations to ensure that the money is used properly.
Well, Ryan, I think we've identified a huge opportunity here. I want to thank you very much for
Thank you.
Coming on to the show.
Thank you for
we
your
want to
service.
have you back because I want to take this deeper.
I'd love to.
So thank you very much for watching Proud Veteran Outreach. Stay tuned for next week, and we will bring you more encouragement for supporting military vets.
Thank you.